Hello and welcome to another super speedy summary. This is Dr. Joshua Goldenberg. Today we're going to quickly summarize a very interesting study that got a lot of press. It was a small study on 21 people where they gave these healthy volunteers broad spectrum antibiotics and then either gave them probiotics, nothing, or fecal microbial transplant and tracked their microbiome to see how quickly it normalized. So a very interesting study, got a lot of press, came out in the very fancy journal Cell. So here's the problem, of course, is that antibiotics are very often necessary medically, and broad spectrum antibiotics are prescribed often, but they can, especially broad spectrum antibiotics, can really mess with our gut flora. And so, of course, there's this thought to use probiotics, and our research team and others have shown that using probiotics alongside antibiotics has very good impacts on clinical outcomes, but no one's really done a very good job exploring the actual microbiome. So here's the study. Do using probiotics speed up the return of the patient's normal microbiota after antibiotic exposure? And in summary, no. So pretty interesting, actually, surprising findings. So first of all, it's important to note that they didn't look at clinically important outcomes. They were simply tracking the microbiome changes after broad spectrum antibiotic and their return to normalization. They weren't tracking patients with a disorder or disease, and they weren't tracking those outcomes. So that's important to note. But still, as Dr. Day says, as for an intellectual exercise, it was an interesting study. What we see is that those patients that were given probiotics, they did not have a normalization to their baseline microbiome even at the last check-in 5 months after they started the study. So very interesting there. Amazingly, if they were given fecal microbial transplants of their own feces, so autologous fecal microbial transplants, they had a return to normal flora within 1 day, which is amazing. But of course, who's going to be getting an FMT after regular rounds of antibiotics? I don't know, maybe some of you. But the more likely alternative is just to do nothing. And in those patients, we actually saw a relatively quick return to baseline within 3 weeks. So those are the main take homes. A lot of limitations of this study, but again, as an intellectual exercise, very interesting.